Have you ever actually stopped and looked really closely at a birthmark, like maybe one you've had your whole life or a tiny spot on a newborn baby, and just wondered, what is this, really? Well, welcome to This Explainer. Today we're going to explore the absolutely fascinating science behind the incredible variety of marks we are born with. Because, you see, far from being just random blemishes or spots, these marks are actually complex, highly individualized maps of early fetal development. By understanding the anatomy of birthmarks, we can literally trace the journey our own cells took before we were even born. It's kind of like a biological time capsule.
To make sense of all this, we're going to walk methodically through 6 key areas. We'll start with the basics of birthmarks, move right into the vascular varieties caused by blood vessels, and then piece together the pigment puzzle. From there, we'll uncover a really fascinating deep blue optical illusion, explore dynamic tissue and texture changes, and finally, look at the big picture of embracing these unique variations.
Okay, let's dive into this. Section 1. The basics of birthmarks. Decoding the nicknames.
So if you've ever spent any time around a newborn, you've almost certainly heard these terms. People will point to a little pink patch on a baby's forehead and say, "Oh, that's an angel's kiss," or they'll see one on the back of the neck and affectionately call it a stork bite. But what exactly are these colloquial terms referring to on a biological level?
Medically speaking, these are called Nevus Simplex, or more commonly, a salmon patch. They're incredibly common and absolutely 100% harmless. They're basically just flat, pink, or pale red areas caused by tiny blood vessels, capillaries, that are slightly wider than usual right beneath the skin's surface. What's kind of fun about them is that they actually get brighter when a baby cries, laughs, or just gets warm, all because the blood flow temporarily increases. And the really reassuring news for parents here is that they usually fade naturally during early childhood. Though I should mention, those stork bites on the back and the neck, they actually often stick around into adulthood, but they're completely hidden by hair, so you'd never even know.
Section 2. The vascular varieties, when blood vessels overgrow.
Now, the life cycle of a hemangioma is just incredibly dynamic. Unlike the salmon patch we just talked about, a hemangioma develops from an unusually dense collection of tiny blood vessels. It often doesn't even show up until the first few weeks of life, usually just starting out as a tiny red spot. But then, between 1 and 6 months, it goes through this rapid growth phase. Because they're often bright red and sit near the skin's surface, they've earned the nickname strawberry hemangiomas. But the most amazing part is the final stage, which is called involution. Over the next several years, the mark naturally shrinks and often disappears completely on its own, no intervention needed. Now, if one does happen to interfere with breathing or vision just because of where it's located, modern medications, like propranolol, have completely transformed how we treat them. It's a real game changer.
And this brilliantly illustrates how our everyday language differs from clinical reality. The common term, port wine stain, perfectly describes that deep red or purple color that looks exactly like spilled wine, but the actual medical term is Nevus flammeus. And unlike the hemangioma that shrinks away, Nevus flammeus is a permanent vascular birthmark made of enlarged capillaries.
So what do we really need to know about port wine stains? Well, first off, they are present right at birth, and they actually grow proportionally as the child grows. They rarely fade on their own. In fact, they often darken or even thicken up a bit in adulthood. Because they reflect a difference in how blood vessels developed early on, doctors will sometimes evaluate facial marks just to rule out rare neurological conditions like Sturge-Weber syndrome. But for anyone looking for a cosmetic solution, modern pulse dye laser therapy is highly effective. It selectively targets those specific abnormal blood vessels to significantly lighten the appearance, and it does it without damaging the surrounding skin at all.
Now, what's really interesting about this next shift is how we go from blood to pigment. Section 3, the pigment puzzle, the role of melanin.
Let's compare 2 very different pigment-based birthmarks. First, we have the Café-au-Lait Spot. Named for its soft tan, coffee with milk color, these are simple, flat patches caused by localized areas of extra melanin. They are super common and totally harmless. Though, as a quick medical note, if a person has 6 or more large ones, doctors might check for a genetic condition called neurofibromatosis type 1. Now compare that simple flat patch to the congenital melanocytic nevus. This one is a true mole that is present at birth. Here, the pigment-producing cells, called melanocytes, actually physically gather in a specific area during fetal growth. It's incredible to think about these cells actively migrating and clustering together before you're even born. They can be tiny or they can cover large parts of the body, often growing coarse hair, and they do require a bit of regular monitoring by a dermatologist just due to a slightly increased risk of melanoma in the larger ones.
Section 4. The deep blue illusion, an optical mystery.
Okay, I really want you to think about this question for a second.
We just established that melanin, the skin's natural pigment, is brown, right? So why in the world is it that some pigment-based birthmarks look bright blue or slate gray? I mean, they almost look like a severe bruise. How does that happen?
So the crucial point is, it's literally an optical illusion. It all comes down to depth. When those melanin-producing cells get trapped deep within the layers of the skin during fetal development, the light hitting the skin scatters differently. This is known in physics as the Tyndall effect. The skin basically acts like a filter for the light, and only the shorter wavelengths, which happen to be the blue ones, are reflected back to your eye. The pigment itself is still brown, but because it's buried so deep, it looks blue to us. Isn't that wild?
And this Tyndall effect is responsible for an entire category of birthmarks. You've got the Mongolian Spot or congenital dermal melanocytosis, usually showing up on the lower back. These blue patches are incredibly common in people of Asian, African, Hispanic, and Native American ancestry, and they almost always fade away in childhood. Then there's the Nevus of Ota, which is a blue-gray mark usually found on one side of the face or near the eye, and its cousin, the Nevus of Ito, which looks identical but appears down on the shoulder or chest. Finally, there's the blue nevus, which is a small, very well-defined blue-black mole found on the hands, feet, or scalp. Now, despite appearing on totally different parts of the body, they all share that striking blue coloration purely because those pigment cells decided to settle deep down in the skin before birth.
Let's move to and see how this builds. Section 5. Tissue and texture changes. Dynamic development.
A perfect example of this texture change is the epidermal nevus. This mark is formed by an overgrowth of cells right in the outer layer of the skin. They might start off just looking tan or skin-colored, but over time, they develop this thick, velvety, or even a wart-like texture. But here's the most mind-blowing part. They often don't form simple round spots. They actually form these curved streaks and swirling patterns across the body, following what are called Blaschko's lines. These are literally the invisible pathways that fetal cells traveled along while your skin was first forming. It is quite literally a visible, structural map of your own cellular history.
And these structural birthmarks are also incredibly dynamic. Take the Nevus Sebaceous and the Becker Nevus, for example. For the first 10 years of life, they remain mostly flat, hairless, or honestly completely unnoticeable. You might not even know you have one. But then, puberty hits. These specific birthmarks are highly sensitive to hormones. So when adolescence begins, the Becker Nevus often sprouts coarse dark hair, and the Nevus Sebaceous, which involves your oil-producing glands, suddenly becomes thick, bumpy, and waxy. It's absolutely fascinating that skin structures formed before you were born can just lie in wait for a decade, waiting for a hormonal trigger to finally reveal themselves.
Oh, and speaking of dynamic texture, you have to hear about this medical quirk. It's called the pseudo-derriere sign, and it happens in a very rare birthmark called the congenital smooth muscle hamartoma. Now, this mark is basically an overgrowth of smooth muscle fibers right inside the skin. Because it's literally made of extra muscle, when the skin is rubbed or even just exposed to a cold breeze, those extra muscle fibers contract, and the birthmark temporarily raises up and develops little bumps. It literally reacts physically to the environment. I mean, no way, right? That is absolutely amazing.
Which brings us to our final stop, Section 6, Embracing Unique Variations, the Big Picture.
So, here is the overarching medical reality, and honestly, the great comfort in all this data. It's simple. Whether a birthmark is vascular, pigmented, or tissue-based, they are overwhelmingly benign, painless, and completely harmless. Crucially, and this is especially true for those blue Mongolian spots we talked about, they are never the result of physical injuries or bruising. Parents, you can take a deep breath. They simply reflect normal, natural variations in how pigment migrated or how blood vessels formed in the womb. That are absolutely not defects, they are beautifully unique, individualized maps of early fetal development.
So, as we wrap up this explainer, I'm going to leave you with this thought. If a birthmark is really just a map of how our cells traveled and settled before we were even born, what unique story is your skin telling the world? Next time you see one of these marks, remember the incredible journey of biological development it represents. Thanks for joining me on this deep dive into the anatomy of birthmarks. Keep observing, keep learning, and we'll see you next time.